If you're pregnant, trying to conceive, or know someone who is, I need you to save this video for later. Before I talked about foods that should be avoided in pregnancy, here is an equally important list. Here is a list of drugs to avoid in pregnancy, their functions, and their effects in pregnancy. 1 are ACE inhibitors or ARBs, for example, enalapril, lisinopril, losartan. These are common hypertension and heart failure drugs, but they can cause low amniotic fluid and fetal renal failure. 2, tetracycline antibiotics like doxycycline. These are common antibiotics but can cause permanent discoloration of the fetal teeth and calcification of the bones and teeth of the baby. 3 are NSAIDs. These are common painkillers, for example, ibuprofen, aspirin, naproxen. It can cause low amniotic fluid in the womb and cause a premature closure of a very important blood vessel in the fetal heart called the ductus arteriosus. It can also cause labor complications or miscarriage. Next, chemotherapy drugs, for example, methotrexate. Methotrexate is a strong cell growth inhibitor. It's used intentionally to end an ectopic pregnancy, so it is very dangerous to use it in pregnancy. It can cause birth defects or miscarriage. Next, retinoids in any form. They are usually used to treat severe acne or psoriasis. They are highly dangerous to the fetus, can cause CNS abnormalities, craniofacial abnormalities, thymic abnormalities, completely contraindicated in pregnancy. Avoid them. Next, warfarin, which is a very common blood thinner. It does the same thing in the fetus and can cause severe bleeding in the fetus. Next are aminoglycosides, particularly streptomycin, a typical antibiotic used to treat bacterial infection, but can cause severe hearing loss in the fetus. This list is by no means exhaustive. There are so many other drugs that should be avoided. This might just be part 1, and then I list others later on. If you know any more, please mention them in the comments. But for now, bye guys.